The Omnibus Budget Reconciliation Act created the Vaccine for Children program in August 1993. The Vaccine for Children is a federally funded program which represents an unprecedented approach to improving vaccine availability nationwide by providing vaccine at no cost to vaccine for children eligible children through enrolled public and private providers. The Vaccine for Children program was put in place as an implementation of the Vaccine for Children Childhood Vaccine Supply Policy, which goal is to keep providing opportunity for enrollment in the program, include vaccine for children activities into other immunization projects, promote maximum participation of private healthcare providers, and promote close coordination among public agencies such as state health departments and state Medicaid programs and programs serving families and children. For many families living in low-income communities, the Vaccine for Children program is a huge support and ensures their family's safety. The Vaccine for Children Childhood Vaccine Supply Policy is extremely important for young children because it ensures that children have access to free and low-cost vaccines. Vaccination protects children from dying from the vaccine-preventable diseases such as the measles. According to the World Health Organization, babies and young children usually under 5 years of age, particularly those living in low-income communities, are the most affected by the measles. Children living in low-income communities are the most affected because their parents are usually underinsured or uninsured and are not able to afford vaccines costs and other healthcare expenses. In other words, children of parents with low income levels will be more likely to not seek healthcare when their children have the measles and other vaccine preventable diseases, exposing the diseases to many others and exposing their children to fatal outcomes. Some argue that the rates of measles cases are high because of the anti-vaccination movement, which is the opposition to vaccines in general, specifically against the measles, mumps, and rubella (MMR) vaccine. However, the anti-vaccination movement is not entirely responsible for the increasing rates of measles cases, particularly among children with low income. In fact, sometimes the reason why a child is not up to date on their vaccines has more to do with poverty and access to health care than a parent's vaccine hesitancy. Data from the CDC shows the connection between poverty and vaccination rates bears out nationally. In the year 2001, public health officials were celebrating a huge victory because through immunization, measles cases saw a 99.9% decrease in the United States. Unfortunately, today, measles outbreaks have resurfaced because of the lack of access to vaccines. The lack of access to vaccines is faced by many children and families in low-income communities and is a public health issue that needs to be addressed now to avoid outbreak of infectious diseases like the measles. Help advocate for the health benefits of vaccines in response to the anti-vaccine movement. Help raise awareness about the Vaccine for Children Childhood Vaccine Supply Policy. Guide parents of children who lack vaccine access to immunization programs such as the Vaccine for Children program. Improving access to vaccines is the best way to decrease and eliminate the measles and other infectious diseases that are vaccine preventable. These children need you to help bring awareness to this issue and get this policy the attention it deserves. For more information regarding this issue, please visit these websites.